Thank you for joining us for our webinar on health insurance. My name is Mia Sampson, and I will be your host today. Today, I have the pleasure of speaking with financial advisor Wendy Turk, who's going to help us answer some common questions about health insurance. Wendy has a bachelor's degree from UCLA in her first love, biology, and she worked as a researcher for a biotech company for 5 years doing DNA research, before then deciding to pivot in 2007 to be a financial planner, her second love. She's always a great resource for information, and her goal is to make finances accessible for each and every client. So thank you, Wendy, so much for doing this webinar.
Thanks, Mia, for having me. Before we get started, I have the fun stuff. Not that health insurance isn't the most fun thing to begin with, but we have the disclaimers. All information that we discuss here is for educational purposes only. It is not meant to be used as financial advice. Please, if you have any specific questions, ask your financial advisor for help.
Yes, thank you for that. And let's just jump right into these questions. So, I'm still younger than 26. I have not experienced picking my own health insurance plan yet. Wendy, how do I choose a plan?
So for most people, they choose a health plan from their employer. Most employers do offer health insurance, and that is how most people get their health insurance. So generally around this time, October through January is open enrollment for most people. Or if you're a new hire, that would be the point in time that your employer would say, here are the plans that you get to choose from. If you don't have an employer, if you're self-employed or you're in between jobs, there are some other options. So in California, there's Covered California. So you would just go to Covered California's website, enter in your information, and they would spit you out a bunch of health insurance plans. There's also Off Exchange. So that's not on Covered California. It's a private insurance plan, but still provided by the big insurers. So you would have Blue Shield, Kaiser, your typical health insurance plans, but you would have it on the private market. So you would be paying for that yourself. So those are the big places where people would go and get insurance if you didn't have insurance in the first place.
Got it. And then in California, mainly due to the pandemic, we've had unemployment rate of, I think it's 11.6 last time I looked up the stat for just California. I think it's lower for the country right now, but if an individual has lost their job or they're laid off, what are their options?
That is a great question. So going back to what I said, a lot of people have health insurance through their employer. So once they lose their job, what happens to the health insurance? And it could be insurance that covered the entire family. If you have 2 people in your household and one person is still working, you can always try to go to the other employer. So to switch plans mid-year, you need a qualifying event. So that would be termination, marriage, having a child, a death in the family, a divorce, but you need something to allow a switch in plans when it's not open enrollment. So I would first go and see if the other employer, if you have 2 employed people, can give coverage. If that's not an option, the most popular thing, and your employer will give you information about this, is COBRA. So COBRA is a federal plan where they ensure continuation of your health insurance even after you've separated from a company. The only thing about COBRA is that people think it's really expensive, but it really is the true cost of what your employer was paying for your insurance plus your portion. So it is the true cost of what your health insurance should have cost. For COBRA, typically speaking, before pandemic, you had 60 days to say yes or no. Either yes, you're taking the coverage, or no, you're not. But after that 60 days, you don't have the choice. If you didn't make the election to take it, you run out of COBRA. Because of pandemic, they've extended that time period to 120 days to choose. So as long as we have an official pandemic, COBRA will give you 120 days to choose whether you want to pick up the insurance or not. And it's retroactive. So let's say that you lost your job at the beginning of this month, so September 1st, it is September, you would have 120 days from now to choose. And even if you didn't choose until January that you wanted the coverage, they'd still cover you, but you have to pay back to the day that you separated. So you'd have to pay back to September 1st. So that's COBRA. You can, if you have an employer that didn't qualify for COBRA, so typically a smaller employer, you still would qualify for CalCOBRA. COBRA federally lasts for about 18 months, and CalCOBRA, so in the state of California, that gets extended to 36 months. So basically, if you don't find any sort of employment benefits, you'll still have about 3 years to figure out what you're going to do about health insurance. That's probably the biggest, but a lot of people complain that it's expensive. So the other places to go would be Covered California and the off exchange market. With Covered California, it may benefit you to go there because you could qualify for a tax credit. So for Covered California, if you earn less than $51,040, you'll get a tax credit. And depending on how much you earn, that will determine your credit. It's a look back period though. So if you have lost your job and you're not going to earn that much this year, you'll probably qualify for the credit, but they'll ask you for your information from last year. So if you input last year's income and you were working full time and you made a higher salary, you might not qualify. And then conversely, if you qualified for the credit but then found a job and you earn too much, when you file your taxes, they'll want that credit back. And then lastly, I would say Medicare and Medi-Cal are good resources if you have lost your job, there is no other employer, all of the other exchanges or options are too expensive. There is Medicare and Medi-Cal, depending on whether you qualify and which program you qualify for. So Medicaid is a going forward number, where if you earn less than $1,437 a month, I know, a lot of numbers, you can qualify for Medicare, but it's a looking forward time period instead of covered, which is looking backwards. So if you're out of a job, you don't have any current income, you may be able to qualify for Medicare.
Got it. Okay, so we had COBRA, which was federal versus state, and then we had Covered California, Off Exchange, Medi-Cal, and Medicare.
Yep.
Perfect.
Yes.
And then how do I know what plan I should choose? Because there's a lot of choices when it comes to plans as well, like HMOs versus PPOs and so on.
Definitely, probably the most frequently asked question is, what do I need? First, what you have to think about is what kind of coverage you want and how much do you see the doctor? Are you accident prone? Do you frequently go to the ER? Are you anticipating that you'll have a surgery coming up? Are you planning on having a baby in the next year? These are all big things that will impact how much you pay for health insurance and which plan you choose. I would say that with an HMO, it generally is cheaper and more things are covered, or there's no copay or no deductible, but you're constrained to who you get to see. So you have a limited number of doctors that you can go to, and typically what they have is a primary care physician, where they're pretty much the gatekeeper to every specialist. They want to know that you actually have a back issue before you try to go see the chiropractor. They're not just going to let you see the chiropractor, and that's how they keep their costs down, and that's how they keep your costs down when you pay for the premium. And then you can go to a PPO, which is your choice. You get to choose the physicians you see. There are in-network and out-of-network doctors. So with in-network doctors, you have specific doctors who have a negotiated price. So they have negotiated with the insurance company that they're willing to take X amount of dollars for this treatment versus if you went into your doctor's office and said, hey, I have cash, how much are you going to charge me? Then they'll charge you their full rate. So for a PPO, you have free choice, but often you have higher costs because you get the choice. And then somewhere in between are EPOs. So they're kind of a hybrid of the two, where they'll want you to see a primary physician and get referred. But then once you're referred, you'll have more choices in terms of the specialists that you see. So that's the big thing that you'll want to look out for. The other things that you're looking out for when you're picking a plan is something called the deductible. So that is how much you're on the hook for if you get any sort of medical treatment. So because of Obamacare, everybody is covered for their annual exam. But let's say you go to the hospital. How much will you pay to go to the hospital? That's when your deductible kicks in. That's how much that you'll have to pay out of your pocket before the insurance starts paying. So there's deductible to look out for, and then there's out-of-pocket max. So that really is the true limit that you'll pay. So for example, going back to the hospital, let's say your deductible was $500, but your out-of-pocket max is $10,000. If you go to the hospital, you'll pay that $500 up front, but then any hospital bill that's above that $500, you'll pay a portion of until you hit the out-of-pocket maximum. So there's a lot of numbers to think about. And then there's another type of plan that I think gets overlooked often. It's called the HSA. It's the Health Savings Plan, where you have to have a high deductible health plan. So for the year 2020, the deductible for an individual has to be at least $1,400. For a family, that number has to be $2,800. And your out-of-pocket max, individual has to be $6,900, and family has to be $13,800 before you qualify. But what a high deductible HSA compatible health plan does for you is you can contribute money into a separate account called an HSA. And that money is tax deductible. And if you use it for qualified healthcare expenses, it is tax free. There are limits to how much you can put into an HSA every year, but it's nice because unlike an FSA, which is a flexible savings account, the HSA is not use it or lose it. So if you don't use all the money in the year, you can carry that forward year over year to pay for future health expenses. So if you know maybe that you'll probably need a knee surgery in 2 years, you could use a high deductible health plan and save up extra money in that account to be able to pay for that deductible or that coinsurance that you'll need to pay when you do have surgery. And then if you never end up using that money, at age 65, you can use it like it's a retirement account. You can take out the money, you'll pay taxes on the gains, but you're free to use it for anything, and it doesn't even have to be health related. So that's kind of the secret weapon if you have low annual health costs, but you do want to squirrel away money just in case.
Yes, definitely something I think is overlooked. I don't feel like I hear people talking about HSAs very much. We actually mentioned it in one of my YouTube videos with Ziad in the past, but other than that, I don't really hear about them that often.
Yeah, it's not always an option with employer plans. Some employers will have just two plans. You know, pick a PPO or pick an HMO, and there you go. And you don't have that option. You usually have more options when you are in covered California or you're in the private market, but then you might have too many options because often it'll spit you out 30 different plans that you could apply for, but you may not know the difference between a bronze plan versus a silver plan. There are lots of little numbers in there.
Got it. Well, another thing that I wanted to ask you about was I know that I definitely need at least vision insurance because I've actually had LASIK twice now.
Wow.
Yes. But how do I know? Do I need dental and vision insurance? Are those necessities to have as health insurance?
Again, that depends. If you have no vision problems, then, maybe you don't need vision. I have been wearing glasses since I was 13, and I am quite blind now. So I definitely need vision coverage. Same with dental. If you don't really have more beyond like a cleaning every year, you may not need dental insurance. So what I would do is I would look at what each plan covers, and then I would figure out how much I pay if I paid out of pocket. So if I thought about vision, if I went to the eye doctor and I got a year's worth of contact lenses, how much would that cost? And then if I went and saw how much my vision premium costs, are they the same? Do I pay more by having vision coverage? Do I pay less? Oftentimes, you could probably end up paying the same out of pocket for both vision and dental. The other thing with specifically vision and dental is a lot of optometrists and dentists are open to, I guess, negotiation, where if you tell them, I will pay you cash, I don't have insurance, how much will you charge me for a cleaning? They might be willing to negotiate the price on that.
It's interesting.
So I would say for those, definitely look at the numbers.
Right. Well, that's all the questions I have for today. Thank you so much for joining me here, Wendy, and for explaining all of these concepts behind health insurance. Is definitely something that we want to continue to educate everybody on. And yeah, we will see.
Yeah, you're welcome. I feel like health insurance is one of those things where there are a lot of numbers. So if you have any questions, that's why you would have a financial planner, because you could say, I don't understand what any of this means. Please look at this, Wendy, and then I will translate it into English for you.
Yes, and Wendy is a great person to talk about this with. So thank you for joining me, and we'll see you next time.
Thanks for having me.